With the Venmo debit card, you can Venmo everything. Your favorite band's merch? You can Venmo this. Or their next show? You can Venmo that. Visit Venmo.me/debit to learn more. The Venmo MasterCard is issued by the Bancorp Bank N.A. pursuant to license by MasterCard International Incorporated. The card may be used everywhere MasterCard is accepted. Venmo purchase restrictions apply.
With a major selection of the looks your kiddos love starting at just $4 in the Walmart app, a new school year means a stylish new them. Who knew? Find skater skirts and Crocs that say, I'm casual but cool. Sparkly sneakers that say, it's my classroom, you're just learning in it. And preppy polos that say, I'm the teacher's pet, even if they're mommy's menace at home. Find their favorite styles starting at just $4 in the app. The Walmart you thought you knew is now new.
This episode is brought to you by the world's first reposado from Tequila Herradura. Made with slow-cooked, hand-harvested agave sealed into oak barrels and aged 11 months. Before being enjoyed in your glass. Experience the world's first reposado. Tequila Herradura. Please drink responsibly. Responsibility.org. Tequila Herradura. 40% alcohol by volume. Imported by Brown-Forman, Louisville, Kentucky. Herradura is a registered trademark. Copyright 2025 Brown-Forman Corporation.
You see, your stupid minds. Stupid.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve,
Take a cow for
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine, the first and still only uncensored medical show on the History Broadcast Radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we've got Lady Diagnosis back from sabbatical. Hello, Lady Diagnosis.
Hello, Dr. Steve.
This is a show that people would never listen to on the radio as a medical show. But if you have a question that you're embarrassed to take your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine and at DrScottWM. And do you still have at Lady Diagnosis?
Yes, I do.
Okay, and at Lady Diagnosis. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. So check out stuff.drsteve.com, stuff.drsteve.com. You can find the Roadie robotic tuner. We're still going to get you a Roadie coach, Lady Diagnosis.
Can't wait.
Mel B couldn't find the one that I gave her, so I don't know where it is.
Oh, my God. She lost it?
Yeah, she apparently. And she gave me a box, but what was in it was just picks and stuff. The coach was not in there. So
oh, my God.
Check out Dr. Scott's website at simplyherbals.net. Check us out at patreon.com/weirdmedicine. And if you go to dabblegames.myshopify.com, you can buy Wet Brain, the party game, which really is a fun game. But you got to have, 4 people, it's not as much fun. 6 people to 8 people, it's way fun. And people are yelling at each other and screaming and stuff, and that's what makes it a great game. And we have Dabble Dice coming out very soon. I found a new supplier. And before I had to buy these blank dice and put stickers on them, and it was just a pain in the ass. So I made like 20 sets and took them to the first Hackmania, and that was that. But I found a supplier where we can get the dice made very inexpensively and everything, and should have them in about a month. And that's a really fun party game as well. So
Cool.
yeah, so we're branching out a little bit. Check out Dr. Scott's website at simplyherbals.net. How's things going over there?
Going pretty well.
Now, am I hearing that you're shutting this down?
I'm probably going to shut it down at the end of this year.
Why?
Yeah. Just it's time. It's time.
Just
So stock up.
too much work for not enough money.
Too
Is that
much.
what it is?
A little bit of everything. Yeah. So I'm going to either sell it or close it.
Yeah, I think selling it's a good idea. Nobody else has what you have
No.
in your formulas and stuff.
No, I know they're great, but
Do you have any buyers?
not yet.
I mean, have you looked into it?
Not yet, no. Well, we're going to put it out there to the universe.
Okay. Well, people will be very sad about that. But so stock up on CBD nasal spray.
Yep.
Ooh, I'm in.
Yep.
And nasal rinse for the allergy season that's coming up.
Absolutely.
All right. And then if you want me to say fluid to your mama, cameo.com/weirdmedicine. And I did one for Steve B., who was doing a new podcast. He gave me a $100 tip. It's crazy. I told him if you meant to send a $1 tip and you accidentally got the decimal points off, I'll be happy to refund you. But that was very nice. Thank you.
That is cool.
And we've been working with Mr. Melton on Super Tip. I had it working. Everything was great. And then I upgraded the operating system in my computer, which is stupid. Why did I do that? Everything was working. But I'm getting ready to upgrade to a Mac Mini in here. And so I thought it would flow better if I had the right operating system on there, and it has fucked up everything. So now Super Tip's not working. OBS, we're 40 minutes late getting started. So, anyway, I've been fiddling with this thing all morning because I turned on the computer, all of a sudden nothing worked.
He was fiddling with the tip.
Yeah. Well, the Super Tip is fun. You can
cool.
have Michio Kaku arguing with Stephen Hawking, and you can use my voice. I'm going to send him yours.
Okay.
We got Stacy DeLoach, so people can make him say things. And so what it is, Lady Diagnosis, they go to supertip.gg/Dr. Steve, Dr. Steve, and they can put in text and then choose which voice they want, and then the AI will generate the message using the person's voice.
Oh, that is so cool.
So, and I was really excited about using it today. I told Mr. Melton that I wanted to be the one that didn't require any tech support, and so I really did all this on my own and just followed the instructions, and it worked. And now it doesn't work again, so I don't know what's going on. So anyway, no Super Tip today.
Damn it to hell.
But you can ruin the show. I've got the interrupt the show thing on, which probably won't last very long, because what happens there is people can pay an extra fee, and I don't have to click anything. It just interrupts the show. And then all of a sudden this thing starts talking.
That could be fun.
It has been fun in the past on certain shows. I'm not so sure it'll work on this one. Right. And then we were going to take live calls, and I go to Skype, and Skype doesn't exist anymore. It's Microsoft Teams now, and I can't figure out how to make an outgoing call so I can link up to our call screening software. Yeah. So that's the next 2-3 weeks. That's what I'm going to be doing. Is I'm going to have to finally bite the bullet and redo everything in here. So I shall do that.
It's okay.
Awesome.
All right. Well, you guys have anything today? We can just go straight to our questions and stuff.
We got questions. I do have a question from the
oh, you do?
Chat room. Yep.
Okay. What do you got?
Let's see here from old Johnny Longfeather. Johnny Longfeller.
Johnny Long.
Oh, Johnny Longfeller. Question. Someone told me I need to take zinc and quercetin. Why would they tell me that?
Okay. So for COVID?
Well, I think just in general, but specifically we can talk about how they work. It might help you work like on COVID or flu.
Right.
Certainly.
So quercetin or quercetin, however you want to pronounce it, we have used it for long COVID. So it's a plant pigment. It's a flavonoid.
Flavonoid.
Yeah, or flavonoid, however you want to pronounce it. If you're in
Hillbillyville, Tennessee.
Yep. But it is an antioxidant, and it's anti-inflammatory. And some people have claimed that it has salutary effects in long COVID. So now zinc also has been demonstrated to decrease the duration of the common cold. And when it first came out, it was a nasal spray, and people were getting anosmia from it. In other words, they were spraying the stuff up their nose, and there was a small subset of people who couldn't smell anymore, so they changed it to zinc lozenges. And you're talking about a 1/3 decrease in the time for the common cold, which was why people were pushing it for COVID, because many of our quote-unquote colds are actually coronaviruses that our bodies have gotten used to over decades and generations. And so they figured that, well, that might make sense for, this new coronavirus, SARS-CoV-2, because it does seem to help with the other, endemic coronaviruses. So anyway, so what were you going to say about it?
No, exactly the same thing. Just that both of them have been shown to help some with viruses and hopefully boost your immunity and decrease the length or the duration of the common cold and possibly the flu.
Yeah, I hear studies suggest quercetin may support immune function, though research in this area is still ongoing. So this is one of those things where people see some rat study and then they go, okay, well, it's safe to take, so you might as well take it. Maybe it'll help.
Well, you find it in fruits and vegetables.
Correct.
So eat your fruits and
vegetables. Do you know, right?
Just like Hulk Hogan
like
used to
Mom
say.
said.
Yep. Just like Hulkamania used to say.
Well, and it's like that whole thing that we have with fish oil. Yeah. They found that people who ate fish had fewer heart attacks and strokes in Nova Scotia, in Norway and stuff. So the American answer to that is we just take a bunch of fish and put them in a vat and render them down and turn it into a pill and then eat whatever we want to. It doesn't really work that way. Do you know, I'm going to ask you a question. You may know the answer to this, Dr. Scott. If you do, you get a bill. What is the vegetable or fruit, whatever, that has the highest known natural source of quercetin? Do you know?
Avocado.
No, it would be capers.
Oh, capers.
Ooh.
Yeah.
Oh, wow.
That's something.
Is capers a vegetable?
Didn't see that.
And then, it's a flower, isn't it? Isn't that what a caper is?
Yeah.
Is a flower.
Yeah, I
it's
love
a pickled
capers.
flower.
Oh, they're so good.
And green tea, black tea, and buckwheat.
There you go.
So there you go.
Green tea.
Okay.
But yeah, Dr. Scott was right about vegetables. Red onions, kale, broccoli, asparagus, bell peppers, and tomatoes. And then the fruits, apples with the skin, blueberries and stuff. Yeah.
So for COVID, are you kind of saying then that cold, cold products will help COVID also, since it's kind of the same symptoms?
Well,
Like
we don't
zinc?
have anything to kill, the common cold. That's the problem. So we have things that'll kill COVID now, with the advent of malnupiravir and Paxlovid, and those things will actually, inhibit its growth. But and those things presumably, if you had just a regular coronavirus cold, might actually help with that as well. Well, I don't know. They're not studying that because nobody cares about the common cold. But yeah, zinc that was the hypothesis that since zinc decreases common cold, and very many common colds are endemic coronaviruses, that maybe zinc would be effective for this coronavirus as well. So that's why people were taking it. But anyway, so when we started having people with long COVID, there were some people that were claiming that quercetin. We don't have great data on any of this, but since it's a flavonoid, unlikely to do any significant harm. So just make sure you read the label and take things based on what your primary care tells you. So anyway, all right. What else? Did you have anything else?
Got one more.
Yeah.
Yeah, just one just popped up from Chris Mack. Thoughts on using vascepa prophylactically? So that's VASCEPA.
It's a fish oil. Right? Yeah.
It's an EPA fish oil.
So prophylactically for what? That's the thing. So they prescribe it to reduce cardiovascular events, heart attack, stroke.
What's
stuff like that,
prophylactically mean?
to prevent something.
Oh, okay.
You heard of a prophylactic, like, a condom?
That's what I was thinking.
Yeah, it prevents
and they're putting
disease
it on their
and
penis.
Pregnancy.
Okay, that's what I was wondering.
Yeah. Right, but no, they're not putting this.
They're
on
not rubbing
their
the fish oil on their penis because that'd be weird.
That's what I was
No,
wondering.
Prophylactic it just means preventative. So
it's like if you drink, you drink orange juice prophylactically, maybe to keep you from getting a cold or something.
People will do that, but it doesn't work. But so for people who have very high triglyceride levels, they'll use vascepa for that. They don't really know how it works. It reduces triglyceride production, it aids in the clearance, and reduces inflammation, protects blood vessels. So a lot of coronary disease is really inflammatory disease. Go ahead.
So prophylactically, maybe if you have a
that's why they prescribe it.
Well, sure. Well, but certainly if you're forward thinking or forward looking, if you've got a family history of, say, type 2 diabetes, or you have a family history of increased fat in your blood cells,
or you have
an increase in triglycerides,
right?
Or you think you're going.
Then you're taking it prophylactically to prevent heart attack and stroke,
right?
So whenever I hear a question like that, it's like, well, what are you trying to accomplish? People say, is vitamin D, is it good? And you go, well, for what? To prevent rickets? Fuck yeah. It's the number one thing to prevent rickets. To prevent heart attack or cancer, the data's not very good on that. So to prevent bone loss, it's great. But then, to prevent Meniere's disease, it's worthless. So that's the question. So when you say I'm taking it prophylactically, what are you trying to prevent? If you want to prevent heart attack and stroke in a patient with high triglycerides, then absolutely, definitely worth taking. Okay, it is a prescription medication.
Is it expensive? Do you know?
Yeah, but yes.
Is it really?
Yes.
I don't know.
So that's the question. Would
insurance pay for it? Yeah.
Well, if insurance pays for it, it's great if you've got insurance. It's just eicosapentaenoic acid, it's EPA. You can get it from natural sources as well, and taking vascepa is not fish oil. It is this sort of modified version of EPA. It's eicosapentyl ethyl, whatever. Anyway. Oh, let's see how much it costs. Okay. Well, 30 capsules can cost between $91 and $99 without insurance. Okay, it's not as expensive as I thought. Generic versions cost $21 to $44. Yeah.
Yeah. Well, the other way is just to take the stress off your liver so it won't produce so many triglycerides.
Yeah.
Lay off some sugar and.
Yeah. Sometimes people just are genetically programmed.
Sure.
And I take krill oil. I'm hoping to do kind of the same thing.
Yeah, I do too.
Yeah,
I take it.
So fish oil does actually do something. Do you recommend
Go
that?
ahead.
Well, I was going to say I personally take it because I don't think it hurts anything, and I think if it does help, I will gladly take those.
Yeah, the data on fish oil wasn't as good as we all hoped it would be,
but it's not bad.
Yeah,
there's hope.
It probably doesn't harm anything.
Yes, exactly.
So you're saying there's a chance.
She's saying there's a chance.
Right.
Exactly. So I'm with it.
All right.
I'll give it a shot.
I'm down with it.
Well, I'm not recommending that anybody take anything.
I'm taking it.
Well, you go right ahead. You do whatever you want to do. All right. Here, let's.
This episode is brought to you by San Pellegrino Ciao, a new kind of flavored sparkling water. The kind made with real fruit juice, a pinch of Sicilian salt, and the sparkle of the Italian sun. With no added sugar and just 10 or less calories per can, enjoy. With love, from Italy. By San Pellegrino Ciao now.
Hey, it's Ryan Reynolds here from Mint Mobile. Now, I was looking for fun ways to tell you that Mint's offer of unlimited premium wireless for $15 a month is back. So I thought it would be fun if we made $15 bills. But it turns out that's very illegal. So there goes my big idea for the commercial. Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.
Finding a new job is stressful. But with Indeed, it doesn't have to be. Just fill out your Indeed profile with your skills, experience, and desired salary. The more you fill out, the better your matches will be. And hearing from hiring managers will be 2 times more likely. Relax. That's your Indeed profile sending opportunities your way. Indeed, the world can work better.
This summer, try the new Strato Frappuccino blended beverage at Starbucks. It's the classic blended iced coffee you know and love, now topped with a creamy layer of handcrafted brown sugar cold foam. Available for a limited time. Your Strato Frappuccino is ready at Starbucks.
Today's top story, the flavor merger of the century between the Peanut Butter Group and Chocolatey Corp. Joining me is a PBC executive.
Thanks for having me, Barry.
Now, how did you know the merger and the byproduct of it, Jif peanut butter and chocolate flavored spread, would be a success?
You know, it was a gut feeling, a rumbling, if you will. Besides, they're 2 titans of taste.
Very true. Goes great with pretzels.
And pancakes.
Apples too, I bet. Try Jif PBC today.
Uh-oh. Oh, now here, see?
Hey, Dr. Steve, it's Mike from New York.
Hey, Mike.
I've been listening to you since the old Opie and Anthony days, and you've often talked about leg cramps, which I have, and how quinine used to be used, but it's illegal in America now. I was looking for some medicine for my wife, and I stumbled across...
Well, when you say it's illegal, it's not legal for me to prescribe it anymore. So there we go.
To prescribe what now?
Quinine.
Well, oh, gotcha.
This company, BioCrowder, it's a German company, but they sell quinine pills. I bought some through Amazon, and they have helped tremendously. When I don't drink tonic water before I go to bed, and I take quinine pills instead, it helps.
Yeah.
My leg cramps are almost totally gone, so it's a big help. I'm not sure if they changed the law or somehow Amazon is just pushing this stuff out and not worrying about it.
Yeah, quinine was kind of banned in the United States in 2007 for a couple of reasons. One, there was a study that showed it wasn't effective in treating nocturnal leg cramps. Oh, that one was bullshit. Mm-hmm. But they were concerned that it had a narrow therapeutic window, meaning that the difference between a dose that would help you and a toxic dose is small. So you got to get exactly the right dose. And if you take too much, you can get seizures and coma and death. That would be a lot, taking a lot.
Oh, a lot, yeah.
But the FDA concluded the risk of quinine outweighed its benefits, and they banned its use in the United States. It's still used in other countries for the treatment of malaria. But, in lower doses, it can cause low platelet counts, destruction of red blood cells, and allergic reactions. So, but you can still get it in tonic water, and the amount in tonic water doesn't seem to be toxic. You'd have to drink gallons of the stuff, so that's why I recommend people take tonic water. Where these pills are coming from, I think you can actually buy it on Amazon. I don't know how that's possible. So, I think, here's the U.S. Okay, so here's FDA. Serious risks associated with using quinine to prevent or treat nocturnal leg cramps. Low platelet count again. Fatalities, renal insufficiency have been reported. These are the prescription. 2001, 51,000 patients received a dispensed prescription for quinine from U.S. outpatient retail pharmacies. And in 2008, it was 206,000. So we used to prescribe it. But
anything in excess is bad, so why can't
correct.
They just let us work it out?
Well, that's what they're saying, is that the therapeutic window is so narrow. But, it says the majority of quinine use is associated with off-label indications relating to leg cramps and muscle pain. And so therefore, now it does say that quinine is FDA approved for the treatment of uncomplicated Plasmodium falciparum malaria, but it's not considered safe and effective for treatment. So it's still out there. You just can't write it for that indication.
So what else can you do for leg cramps then? Is there anything else?
Well, sure. I mean, there's all kinds of
of
things that you can do. Data support efficacy of a drug called verapamil, but quinine tonic water is going to be less toxic than verapamil. Verapamil's a calcium channel blocker that's used for blood pressure and slowing down heart, certain tachycardias, gabapentin, and then they recommend carisoprodol. Go F yourself. Carisoprodol is also known as Soma. It's an extremely addictive tranquilizer.
Yeah, don't take that.
Yeah, and then orphenadrine, which I don't know much about, and then vitamin E in the dialysis population. So it says one or more of these agents should be tried before resorting to the time-limited trial of quinine for the treatment prevention of leg cramps. Now, this was from...
spoken like a true pharmaceutical company.
Yeah.
Cover your ass.
Well, this was from...
Take our pill first.
Consultations in Pharmacology... the Consultant Pharmacist, Journal of the American Society of Consultant Pharmacists. So, not a fan of this answer.
No.
I really just don't see the harm in tonic water, 4 ounces of tonic water before you go to bed. And most people who do it, and we have a phone call about that. Let's just get this in here right now.
Hi, Dr. Steve. I called in a while back about nighttime leg cramps. I just wanted to thank you for the tonic water suggestion. I've been drinking it every night before bed for almost 5 weeks now, and I've not had any leg cramps. Thanks again. I've been listening since the first show, and it's not only entertaining, but helpful.
Hey, thanks,
Thank
man.
you.
Well, here's, now this is an old, I think it's from the Journal of Geriatric Internal Medicine. That's given the side effect profile of quinine. Now, this is when they were prescribing pills, non-pharmacologic therapy. In other words, regular passive stretching of the affected muscle is the best first-line treatment. Well, that's just a treatment when it happens, and it sucks. You have to get out of bed and walk around. Mm-hmm. We're trying to prevent the fucking things, not just wait till they happen. It says for persons who find this ineffective or whose quality of life is significantly affected, a trial of quinine is warranted. So there you go.
So how close is that to restless leg? Is that completely different as far as the quinine?
Yeah, quinine's not effective for restless leg.
Okay.
So we use other medications for that. And that is a thing where people say they feel like their legs are full or they feel like they're just compelled to move them.
Yes.
And they have to move them. And then you can get this repetitive leg motion disorder, which apparently I have when you're sleeping. And that'll affect your ability to attain deep sleep.
You can start kicking.
I don't know that I do. They said it was mild when I did my last sleep study. So I don't have any discomfort from it, but I don't attain deep sleep. I get about 30 minutes of deep sleep and all the rest is light sleep. So I'm at high risk for dementia just from that.
Gosh.
Yeah. So I tried taking gamma hydroxybutyric acid. It's sold as sodium oxybate. It's also known as, roofies, I guess. It's not Rohypnol though, but it's a date rape drug, and so it's highly regulated. And I tried that, and it didn't work. I would wake up at 4 a.m. wide awake, and then you have to take it again. So you're supposed to take it. You're supposed to wake up in the middle of the night and take the second dose. It's like this is stupid.
That's stupid.
Yeah, this is stupid. Well, wake up and take your sleeping medicine. So
knock you back out again.
Yeah, and it didn't increase my deep sleep either. So
I found a drink that might make you go night for a little while.
Really?
Wine?
With a special cannabinoid in it.
Oh, really?
Oh man.
Well, that's supposed to help too.
Shit, yeah.
Yeah.
The pot or the cannabinoid.
Well, they're even saying now that
the weed.
that chronic cannabinoid use, even in gummies, has got some adverse effects. So.
Well, hell, everything's got
Everything's bad.
Try getting married once or twice.
Oh.
You're better off taking your gummies. I'm all
Yeah.
Oh man.
Oh well. Yeah. Here's cannabis. Okay, this is from Colorado. Cannabis, though, it says heavy use of cannabis can damage your memory. Damage can last a week or more. Heavy use of cannabis may lead to development of psychotic disorders such as schizophrenia. Let's see.
And joy.
Overjoy syndrome.
Yeah.
Too much happiness.
Not being pissed.
Yeah, this is all about
off.
smoking, though. There was a thing about gummies that just came out not too long ago. Well, I wasn't prepared for this, but let's look it up for next show.
Okay.
Yep.
All right. Okay. All right. Here's one for you, Dr. Scott.
Dr. Steve, I started having a pain in my hip about 6 months ago. I went to an orthopedist who had done good things for my knees. They did an x-ray, didn't show anything. So I happen to have appointments with a chiropractor and a massage therapist. No help there. Asked my GP and talked about an MRI. She said my insurance would probably make me go to a PT, but since exercise makes it worse, I said let's try without it. While I was waiting to find out whether the insurance company was going to say yes or not, I had to go for another x-ray because for some reason the first one wasn't good enough. PT people call me up about the thing that I didn't want. Insurance company came through, got the MRI. MRI didn't show anything. So I went back, and now the GP is now saying I should go to another orthopedist, even though the first, my orthopedist didn't find one. So I've got a question. The GP is going to kick back for referrals, and what kind of doctor should I now actually try to go to, since the first one, didn't do it?
Yeah. Okay. No, they don't get kickbacks. That's highly illegal, and there have been health systems that have gotten dinged for almost $1 billion by allowing kickbacks in the past, or referring preferentially to entities that they own. And you can look up Hospital Corporation of America fine. They had the highest fine of any health system in the country way back in the day, and it was like $800 million. Way back then, almost $1 billion. And for, if I recall correctly, for self-referral. So I'm not an attorney, so just look that up on your own. But so everybody learned their lesson. Nobody's pulling that shit. I can't say, hey, I'm going to send all my patients to Dr. Scott as long as he gives me, $50 for every patient. Right. It doesn't work that way. No. So that's not an issue. But I'm thinking physical medicine rehab for this person. They've done all these tests. They couldn't find anything, but he's still having pain. It sounds like, well, I'm not going to no nursing home. Physical medicine rehab is the name of their subspecialty. They deal with people who have pain from trauma and other things, and then also people that have pain they can't figure out where it's coming from. Yep. And that might be the way to go, rather than going to another orthopedist, because orthopedists are surgeons. Right. So if they can't do surgery, they're just sending you to physical therapy.
Right. It's a perpetual loop.
Right. The PM&R person may be able to do some invasive treatment that might actually improve the pain. They may do a nerve block. Who knows?
I would, this is the kind of stuff I see every day.
And then that was the other thing I was going to say is go to somebody like Dr. Scott.
Yeah, that knows what they're doing. But, the other one would be a sports medicine.
Yeah.
Doc, because of, in a
But again, they're going to send them to physical therapy.
Well, but what here's my point. Sports medicine may do a little deeper dive into the mechanics of what's wrong in diagnostics versus doing an injection or just simply sending them back to to PT, which is, we're just finding a great physical therapist that'll do those because hip pain can be really challenging. We'll talk about it next.
Yeah, no, it's okay. Yeah,
well, I was just going to say it. In
3 minutes.
Well, it is about where the hip is hurting. If it's towards the front of the hip, like in the groin, then we do think arthritic hips. We do think maybe a labral tears. If it's on the side, they poke on it and it hurts on the side.
We'll tell people what the labrum is.
Well, the labrum is just it's a soft capsule that the bone of the femur, the humeral head, slips up into inside the capsule. Bone. Yeah, it's like a suction cup kind of. It's like a suction cup.
Yeah, and it's soft and
it's
it can
soft
tear.
tissue, and it can be really hard to see image wise. It can, and that can lead to instability inside this joint. So, but here's what I see most times. Then we'll get out of here. Is most times it's a dysfunction in the sacroiliac joints. You get stiff in your lower back. All the fascia locks down, so your gluteal muscles and your hip muscles in the front,
muscles.
Your ass muscles, they'll have to work really, really hard to move. It's like having a flat tire and still driving.
And again, the PM&R guy could inject that.
Well, or you can start doing some stretches and some yoga stretches.
True.
Yoga's great.
But you could see an acupuncturist in the meantime, too. Just make sure they have DOM after their name. It's not somebody just did a weekend class in acupuncture. You don't want somebody that's a dabbler in acupuncture. You want someone that's committed their career
weekend
to
courses.
Right. All right.
All right.
Well, listen, thanks go to Dr. Scott. Thanks, Lady Diagnosis. And Lady Diagnosis always with the excellent layperson questions when we start throwing jargon out there. Thanks to everyone who's made this show happen over the years. And many thanks to our listeners whose voicemail and topic ideas make this job very easy. Next couple of shows, we're going to have some big changes finally. We're going to be taking live calls again, and we will have this super tip system. I'm very excited about it. You're going to enjoy the voices that I've chosen, I think. And go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.